Good afternoon, dear students, and welcome to this session of Post Basic BSc Nursing, Medical Surgical Nursing BNS 206. Today we will discuss about the various skin disorders and how a nurse can manage these disorders. You know, over the time in India as well as globally, many skin conditions have arisen. People are suffering from acne, they have problem related to their skins, there is scaling of the skin, itching all the time. So, what are the major problems that affect the skin and how can we manage them? How can we educate the people who suffer from these diseases and what is your role is what we will study today. So let us begin. So, disorders of the integumentary system may be caused by various factors. These may be allergies, infections, infestations, cancers, and so on. They, if neglected, can lead to skin damage. They require a lot of treatment, and the recovery may not be so quick. So, skin disorders may also cause considerable amount of psychological problems and social isolation in addition to the physical problems that occur. So, how you as nurses can help these patients is what we are going to study today. What are the common manifestations of the skin disorders? We know what is manifestation. Manifestation stands for symptoms, signs, and symptoms. The first important symptom is urticaria, which means itching. People usually complain of itching, that is kharish. So, it is usually the redness of the skin which occurs due to this pruritus, and in this there is increased blood flow. So उस जगह जब लालिमा आ जाती है, that is what we mean by urticaria. The lesions are usually localized. They can also be generalized, that is all over the body. Second is pruritus. Pruritus comes along with urticaria and usually is present in all kinds of patients, especially in skin disorder. You feel or the patient feels that there is a tingling sensation over his skin, which may also be due to itching or other kind of known sources. It becomes more pronounced when a person goes to bed, that is during the night. Cirrhosis, which is the dry skin. Usually, when there is skin infestation, the dry skin usually occurs. So, you know, in the dry skin, many emollients can be used. But sometimes, due to skin problems, the dryness can be very heavy and you require medical help to deal with that dryness. Usually, there is also scaling, and it is common in positions like anterior legs, dorsal surface of hands, and the forearm. What will you teach your patient if he suffers from these three important common manifestations affecting the skin? If there is urticaria, that is, if there is redness, you will help the patient take steroids if they are prescribed. You will help the patient change the body position, antihistamines like cetirizine and all, in order to reduce the chances of urticaria, and cool compress like ice pack. If there is pruritus, you can use emollients, that is, you can use wax, paraffin wax, Vaseline, and all. You can also tell the patient to take antihistamines, tranquilizers, and steroids if they are prescribed. Cirrhosis, that is, if there is dry skin, the patient needs to wash his clothing in mild detergent. Hard detergent should not be used. Do not use any fabric softeners because they also reduce the chances of warmization of your skin, that is, the moisturization of your skin gets reduced. Avoid using perfumes, lotions with alcohol. Apply skin lubricants. Clean the skin with only mild soap, and the temperature of the water should be tepid, that is lukewarm. You should also tell the patient to increase the fluids, keep the nail trims trimmed in order to avoid itching, wear loose clothing, and cotton gloves may also be prescribed so that they do not scratch their hands and arms so much wherever these pruritus, urticaria, and dry skin is there. Next, we will try to see what are the various conditions of the skin that affect the patient. So these are the various skin disorders. I have listed 11 skin disorders. There are many more, but these are important ones that you need to learn and read about. Let us try to study them one by one. Number one is bacterial skin disorders. Bacteria infects the skin. It causes a break in the skin, which causes these bacteria to go into the skin and cause the infection, which is known as pyoderma. There are various bacterial infections. Folliculitis, which is the infection of the hair follicle. The organism which usually causes it is Staphylococcus aureus. The causative factors are illness, mechanical irritation from shaving, clothing, hot tub use, and infection from any other person who has the infection. Second is fruncles and carbuncles. Fruncle is known as boil. Many people have boils, that is pus filled small area over their skin. If number of these fruncles join together, they cause what is known as carbuncle. What is the causative factor? Friction, pressure, plugging of the sweat are very common. It is common in patients who are debilitated, that is malnourished. Fatigued patients, obese patients, patients having altered immune responses, diabetes, acne, dermatitis, and poor hygiene are also the other factors. The other one is what we know is cellulitis and erysipelas. Cellulitis, as you know, is known as infection which involves the dermis, lymphatics, and subcutaneous tissue. Erysipelas is superficial acute form of cellulitis. You can see these in photographs. These photographs show cellulitis and the awab is known as erysipelas. Erysipelas is usually present in the form of butterfly rash, and it is also known as Saint Anthony's fire because it gives a very sharp red color to your skin. The causative reasons are usually group A and B streptococcus, or sometimes staphylococcus aureus may also be there. Bacteria generally invade the tissue and the skin, and cellulitis can also occur. Impetigo is also very common, but impetigo is common in children. You can see so many impetigo papules and macules over the child's mouth. It is common contagious skin infection which is caused by beta hemolytic streptococci. The exposed surfaces of face, arms, legs are very common areas. The causative factors are tropical climates, poor hygiene, poor nutrition, and compromised health. What do we do if we want to manage it? We need to maintain the hygiene with antimicrobial cleansers. We need to have topical antibiotics like pectiteracin for folliculitis, cephalosporin for fruncles, penicillin for impetigo. These are the various medicines you need to use. We have also mentioned that erythromycin can also be used if the patients are allergic to penicillin. If there is a boil, we need to incise it, that we need to cut the boil and we need to take out the pus. That is what we need to do in, especially if there is a fruncle. We need to do supportive care, which involves fatigue, fever, chills, headache, and myalgia. If these symptoms are present, supportive care would mean giving them medicine for all these symptoms. Warm compresses can be used to reduce discomfort, erythema, and edema. We need to soften the crust by soaking them in warm water and applying saline compresses. We also need to remove the crusts and wash the lesions gently 2 to 3 times a day to avoid the crust formation. Next very important disease that is occurring in many people is known as psoriasis. It is a very chronic disease of keratin synthesis. I have seen many patients and many upcoming new people who are getting this infection. It has a slow onset and there is period of inactivity and exacerbation. That means sometimes it decreases, sometimes it increases. Sometimes spontaneous remission, like there is decrease and sometimes it just comes up on its own even after you have completed your treatments. Lesions are usually raised with erythema. Sharply demarcated papules are there, which usually combine to form plaques. Papules are covered with overlapping silvery or shining scale. You can say how much scaling is there on the skin of this person. This means when the lower form of epidermis is getting formed, the upper, there is so much division or mitosis of these skin cells that even though the lower ones get formed more often as compared to upper ones, so scales get formed. Usually, bleeding can also be there when scales get removed. What are the causes and what happens in this? This can be genetic, biochemical, or immunological, but the actual cause is not known. Some doctors say, or some health specialists say, that this is due to some genetic problem. Some say that this is environmental, but nobody actually knows. So what actually happens in this case? There is three components of this disease. There is increased mitotic rate of the skin cells. Usually it becomes 4 days, but normally it should be 28 days. So how quickly the skin cells get divided? Then there is faulty keratinization. Usually for a normal skin, keratin deposition occurs in the skin. But in this case, there is faulty keratinization. More and more keratin gets dumped into the skin, causing the formation of the scales. There is a dilation of upper dermal vessels and intermittent discharge of the various leukocytes, which causes an inflammatory response. There is lot of management, but the true management is yet to be found. We can use corticosteroids to manage the inflammation. We can use coal tar preparations. We have shampoos and all to relieve the scaling, itching, and mitotic activities. We can use anthralin, which is actually a dienthral compound, to reduce the mitotic activity. We can use vitamin D in order to inhibit the cell proliferation. Next is we can use sorelin, which is a photosensitizing agent. We can use vitamins, which are oral retinoids. We can use anti-neoplastic agents, which are methotrexate. Anti-infect we can use anti-infective agents like penicillin and all. We can also use short-wave UV therapy. We can use Gaukerman therapy, which is photosensitizing coal application. We can use long-wave ultraviolet therapy, which involves sorelin. We can use X-ray therapy and occlusive dressings, which you can see. Next is malignant melanoma. Melanoma means skin cancers. Skin cancer, which is known as this, is usually malignant transformation of epidermal melanocytes, which leads to local or systemic metastasis, which spreads to the dermal layer. Lesion, as you can see, is of various colors. There is irregular border. It can be black, brown, or red. Cause is not known, but the warning signs are change in size, color, shape of these papules which are present. As you can see in the figure, it is black color. It can also be confirmed by biopsy, complete blood count, and checkups for metastasis. How do we manage? We have primary prevention, which can be achieved by sun protection. There is surgery for tumor and cryosurgery and electrosurgery. There is wound care, and we also need to maintain asepsis, that is, we should avoid infection. Radiotherapy, chemotherapy, because it's a kind of cancer only. So we need to utilize these therapies for the patient. We should look out for complications of metastasis to brain, bone, liver, and lungs. Next is a fungal skin infection. Fungal skin infections are very common, and these are also very common during the months of monsoon and very common in rural areas. Usually in this case, the fungi are very complex than the bacteria, and they affect lot of areas in the body and cause inflammatory responses. So what are the different kinds of problems that occur as a result of fungi? One of the most important fungus that causes the problem is tinea. So tinea, it is the overgrowth of plant-like organism which consumes the organic matter. So it will consume your skin cells. It will eat up your skin. What are the risk factors? Hot climate, poor nutrition, immunosuppression, debilitation of the patient, that is, patient may be very malnourished, patient may not be eating, not caring for his skin, he may be bedridden. So, all these factors are there. Then, what are the causes? As we know, tinea is the cause. This fungus comes from humans, animals, or it may be present in the soil. And it is usually diagnosed with the help of potassium hydroxide with fungal culture or gram stain if there is a bacterial infection. There are various types of tinea. Let us begin. First tinea, which affects the foot, is known as tinea pedis and or is also known as athletic foot. It starts in the toe webs, extends to the plantar surface, causing itching. Then we have tinea corporis, which affects the body surface and causes ring shaped plaques. You can see in the figure it is causing a ring shaped plaque. There is also scaling and erythema. Then we have tinea curis. It is known as jock itch. There is a lot of itching in this case. Usually, warm, moist areas of the groin are effective. Intertriginous areas are those where two skin surfaces rub against one another, which is common in groin and axilla. Brown to red colored scales may be present or may be sometimes absent, but it is usually of bright color. But there is a lot of itching. Then we have tinea capitis. It is present on the scalp. There is erythema and scaly rash with pustules and hair loss is also present. Then we have tinea unguium, in which the fingernails or more commonly the toenails are affected. The other kind of fungal infection is candidiasis. Candida is albicans is the one which affects it. It is mostly present in various areas. If it is present in vagina, it is vaginal candidiasis. If it is present in mouth, it is oral candidiasis. Risk factors are hospitalized persons, diabetes, immunosuppression, lot of diseases, environmental factors like warmth, moisture, antibiotics, Cushing diseases, all are the reasons. The main cause is Candida albicans. It affects the skin, causes erythema, and is surrounded by satellite pustules. The area may appear as dry, there may be scaliness, and pruritus may also be present. Now, there are plenty of areas where it affects, and based on that, candidiasis is of following types. Peduncle candidiasis, which involves the nail fold, that is, affects the nails. There is tenderness, erythema, and oedema. Usually, posterior nail may also get folded. Intertrigo is the involvement in the axillary inflammatory groin and perianal areas. Thrush is known as oral candidiasis. As you can see, it is the infection in the mouth. It appears as thick white colored. It is very thick, it is whitish in its nature. It is usually present in patients who may have been on ventilator or who are having oral secretions coming out, so it is present in that case. Beneath this plaque, the mucus is usually erythematous and patient may complain of a lot of pain when he eats if he is conscious. Vaginal candidiasis affects the vagina and is common in females. There is also intense pruritus, edema, and there may also be some discharge. Then there is perilechi, which is erythema, scaling and fissuring of the corners of your mouth, and these lesions are very, very painful, so patient may also not like to eat anything in this case. What can you do? First is non-pharmacological intervention. We need to tell the patient to maintain a dry environment of his skin. He can use powder or antifungal powder. We can get them at the pharmacy at an easy cost. Then we have to instruct the patient to have good clothing, like cotton clothing may also be used, especially the clothing as compared to the weather, and cotton is the best. So he has also to wash this cotton clothing in warm water and then usually sun dry it. Advise the patient about his clothes and socks. Socks he needs to wear. Underwear which he is wearing needs to be always and frequently washed. He should always wear these clothes, shoes and socks which are dried properly. Public facilities like gyms, locker rooms, swimming pool must be properly used because infection may be there. He can use cold moist soaks, so we do not have to tell him to use warm soaks, which is used in case of bacterial infection. Here we are telling him to use ice packs or cold moist packs so that he is able to have a certain relief. Weight loss can be told to the patient and wearing protective gloves in order to avoid exposure to the moisture. What medicines will you give? Usually antifungal therapy is given. It is clotrimazole, mycomenazole and many like that. Miconazole and many like that. Then topical corticosteroids like hydrocortisone may be used. Nystatin's suspension and other such suspensions may be used like in form of lozenges or tablets the patient can chew. Wet dressings with the baro or Domi-Baro solution can be utilized if there is itching and inflammation. If the infection does not respond to this treatment, then systemic antifungal therapy, that is, a long-term therapy, can be utilized in order to get rid of these fungi from the patient's body. Then there are plenty of viral infections also, but the most important viral infections that affect the skin are rats, herpes simplex, and herpes zoster. Rats are usually benign epidermal tumors caused by human papilloma virus. Yes, this is the same virus which causes cervical cancer in females. It is transmitted through skin to skin contact. There is also herpes simplex, which involves clusters of painful lesions which are grouped together along a particular nerve. It's caused by stress, menstrual cycle, sunlight, cold wind, trauma, immunosuppression, and infections. Herpes zoster. Herpes zoster is the one which causes the chickenpox. But in the skin case, this leads to a more important vesicular eruption. We can see there are vesicles present when there is a rash from herpes zoster. Causes of this infection are increasing age, physical trauma, debilitation, immunosuppression, illness, stress, and fatigue. So, what is the management in viral infection? We need to teach something to the patient that is non pharmacological when no medicines are involved. What we need to teach? Cool water compresses help to decrease the discomfort and pruritus and inflammation. Biofeedback and transcutaneous nerve stimulation and other pain relief therapies can be used for this patient. We can utilize frequent mouth washes and soothe in case the patient has any infection in his mouth, like especially if there is herpes simplex present over his mouth. Sitz bath if there is any vulvar lesions especially and other symptoms related to it. Education related to complications of these diseases can be given, like post herpes neuralgia, which is very common in herpes simplex. So, we need to tell the patient about this. We also need to tell the patient that there may be a cause of blindness if herpes involves your eye nerve. Then, we also need to tell the patient that facial and acoustic nerve involvement may also be there. So, patient need to be alert about this. There may also be Bell's palsy, tinnitus and hearing loss. So, patient has to be alert and inform any symptoms to his or her relative, nurse or the doctor. Then we need to teach about the sexually transmitted diseases so as to avoid any reinfection or passing over the infection. We need to teach about avoiding the scratching, cutting fingernails and follow up. And this is common for all the skin infection so that the patient knows what to do, because scratching, having long nails can lead to increase in the chances of spreading of infection. That also has to be taught to the patient. Next is, what medicines will you give? Because medicines have to be given in this case. So, acyclovir ointment can be beneficial for the primary infections in herpes simplex. Oral therapy of acyclovir can be utilized for primary infections. We also need to tell the patient to encourage the fluids, because these medicines can lead to nephrotoxicity, that is, they can affect your kidneys. So you have to drink lots of fluid to avoid any complication. People who are immunocompromised, that is, they have less immunity, can also take this therapy, but they need to take it intravenously, that is, by injections in intravenous. Then antihistamines will help to reduce the pruritus. Analgesics will help to reduce the pain. Topical soaks with the baro solution are also useful because they keep the lesions moist and clean, and these are very useful for early recovery. Then if there is lot of pain because of post-herpetic neuralgia, which is a complication affecting the nerves, especially in the case of herpes zoster and herpes simplex, we can have a combination therapy of tricyclic antidepressants, narcotic analgesics, and intralesional injections with the corticosteroids. So this is how you will manage. You need to educate the patient and utilize certain non-pharmacological interventions. Then also you need to utilize certain pharmacological interventions. Next, another important thing is pemphigus vulgaris. See, look how many scales are there over the patient's body. There are red colored and there are lots of scales, and this is very painful also. This is pemphigus vulgaris, a very chronic, progressive, life threatening disorder where there is vesicles and filled with fluid. Bullae are also there and affects your epidermis and mucous membrane. It is considered an autoimmune disorder. An autoimmune disorder is the disorder where your body own immunity recognizes your skin as a antigen, and it acts on it. So your body itself is acting against your skin. So it is an autoimmune response which causes this disease. Which antibodies are involved? It is circulating IgG antibodies which are involved in this case, which cause the inflammation. There is splitting of the epidermal cells and there is fluid accumulation which is known as bullae. It is known as acanthosis, and it is the one which occurs in the intraepidermal vessels and causes soft bullae. The lesions, they break easily and they form lots of crusts and lead to scar. So usually in this patient, when the scars heal, the whole area is usually blackish in its coloration. So that has to be taken care of. Pain is also very common and it spreads to internal and external parts of the body. We will continue with the pemphigus vulgaris and its management in our second part. So with this, we come to the end of the first part about the management of the skin disorders. So we'll carry over this discussion in the second part of the program.
Do you know that the world's population has reached 8 billion on 15th November 2022? And we are still counting. I don't know where do we go from here. The predictions are scary. Any idea how many people can Mother Earth sustain? India's growing population is a serious concern, and we are soon going to become the world's most populous country. Wow, number one. Population is, after all, a human issue. The UN proposed Sustainable Development Goals cannot be achieved unless and until we consider the population dynamics. So, here we are. Indira Gandhi National Open University offers appreciation course on population and sustainable development. The course explores the linkages between population and sustainable development. In this course, there are diverse issues related to population, environmental safety, livelihoods, human health, migration, urbanization, and much more. The course duration is 3 months, but of course, you can complete it within a year. The eligibility of the course is graduation from a recognized university. So, if you are a development professional, working in a government sector, researcher, or keen to know more about the population and sustainable development, the course is must for you. Hurry up and join this course so that we are able to convert population into demographic dividend and not convert it into demographic disaster. For more information, visit www.ignou.ac.in. Thank you. पहाड़ों पर जाना किसे पसंद नहीं? इस तरह के पहाड़ तो आपने देखे ही होंगे। चलिए, आज आपको विशेष प्रकार के पहाड़ों की सैर कराते हैं। ये हैं कूड़े के पहाड़, जिनके बोझ तले दुनिया दबी जा रही है। इन कूड़े के पहाड़ों में हैं हमारे घरों, कार्यालयों, उद्योगों से निकलने वाली बेकार की वस्तुएं, जैसे इस्तेमाल किया हुआ कागज़, फटे कपड़े, पुरानी लकड़ी, धातु, कांच के सामान, सब्जी फलों के छिलके, पुराने मोबाइल, लैपटॉप इत्यादि। कूड़े के ये पहाड़ न केवल शहरों में बल्कि गांव में भी पाए जाते हैं। अपशिष्ट की बढ़ती हुई मात्रा और इसकी विषैली प्रकृति हमारे पर्यावरण और स्वास्थ्य को नुकसान पहुंचाती है। कभी सोचा है इसका निपटान कैसे होता है, या क्या होता है इन कूड़े के पहाड़ों का? कैसे हम इस समस्या से छुटकारा पा सकते हैं? इन सभी प्रश्नों का उत्तर देने के लिए इंदिरा गांधी राष्ट्रीय मुक्त विश्वविद्यालय अपशिष्ट प्रबंधन में प्रमाण पत्र कार्यक्रम प्रस्तुत करता है। यदि आप नगर निगम में कार्यरत हैं, सैनिटरी इंस्पेक्टर हैं, अपशिष्ट प्रबंधक हैं या अपशिष्ट से जुड़ी हुई परामर्श सेवाएं, अनुसंधान या विकास कार्य करते हैं, तो ये कार्यक्रम आपके लिए सर्वोत्तम है। कार्यक्रम की न्यूनतम योग्यता है 12वीं उत्तीर्ण और इसे 6 महीने में पूरा किया जा सकता है, या अधिक से अधिक आप इसे 2 साल के अंतराल पर भी पूरा कर सकते हैं। कार्यक्रम में शामिल है स्व शिक्षण पाठ्यक्रम सामग्री, ऑडियो वीडियो संसाधन और विभिन्न माध्यमों से शिक्षण की सुविधा। तो फिर देर किस बात की? चलिए समस्या का नहीं, समाधान का हिस्सा बने। अपशिष्ट प्रबंधन में प्रमाण पत्र कार्यक्रम में दाखिला लें। हम आपके स्वागत के लिए आतुर हैं। अधिक जानकारी के लिए देखें www.ignou.ac.in। धन्यवाद।
Welcome back to the second part of management of patients with skin disorders. We have been discussing about various disorders which are bacterial disorders, viral disorders. We have also discussed about many other infections. Now let us start with recapitulation about pemphigus vulgaris. We have talked that pemphigus vulgaris is a chronic progressive life-threatening kind of vesicobulous disorder, and there are plenty of scales on the patient's body, and the lesions they break easily, and they are followed by crust and scarring. So what is the management of these patients? We can tell the patients to take the corticosteroids, and they can be utilized over a period of months, and then slowly whatever medicine is being taken by them, the dosage can be tapered, that is the dosage can be lowered over the time, but this therapy has to be taken for a long term. And for all the skin infections, most of the times Therapy has to be taken for a lot of time. Next is topical corticosteroids. These are usually taken in most of the skin problems, and these are also prescribed for these patients. Then there is immunosuppressive therapy, because I've already told you, here in this case our own body recognizes our skin as a foreign material and acts against it. So there is an antigen antibody reaction. So hence what happens is that if we give any immunosuppressive drugs to the patient, our immunity gets lowered and body's immunity does not act against the skin, which decreases the chances of such kind of problem. So this is utilized. Then there are coexisting infections, if any, we need to control it with the therapy as prescribed. Then what is the other thing is as plasmapheresis, which means changing of the plasma. It may be used in only life threatening situations. Supportive care like hospitalization, nutritional support, lidocaine for oral lesions, antibiotic therapy, blood transfusions, and anemia in case there is anemia to the patient. Colloidal oatmeal baths can also be prescribed in order to decrease any inflammation, any kind of pruritus, and is very beneficial on these patients. Then acne. One of the most common problem everybody faces is acne, and it is very common especially in the youngsters, that is teenagers and young adults. It is the inflammatory reaction of the sebaceous follicles. We can see so many small acne that have grown over this girl's forehead. It causes papules, pustules, nodules, which are very painful. They can rupture also, pus may come out. Open and closed comedones. Comedone is the name given to the pustules having pus, and they can be open and closed. If they are scratched, scarring can also happen. The risk factors are usually genetics, hormonal changes, emotional stress, hot climate, perspiration, use of cosmetics, steroids, contraceptives, friction, and any kind of tight clothing. It usually comes in adolescent during the age of 12 to 35. Flushing, erythema, burning, or stinging sensation occurs during the flushing episodes. Risk factors are fair complexion, conditions that promote vasodilation, exposure to sunlight, caffeine, alcohol, drugs, hot liquids. These risk factors are for acne rosacea. Acne rosacea is a chronic erythematous eruption. You can see redness all over the skin, which is located predominantly on the central area of the face. It occurs during the third and fifth decades of your life, that is from 30 to 50th year, and affects women more than it affects the men. And the lesions can occur and they are more common and similar to acne vulgaris. But the exact cause of acne vulgaris and acne rosacea is not known, and the risk factors are usually fair complexion and all the others that I have already listed. What is the management of these patients? Non pharmacological management is gentle routine cleansing, avoiding any precipitating factors, using any water based cosmetics. What education can be given to these patients? Acne is not a kind of curse. It is not because of your poor diet or your poor hygiene. It is not because of any stage in your life. You need to explain this to the patient because they have a lot of psychological stress. Patient don't need to have any mask on their face. There is no need to wear any straps. It is not going to help you with your acne. There is no need to avoid any specific food. These are all myths that are associated with the acne. There is no any specific food that may be affecting your acne also. This is purely hormonal and usually present in most of the cases. It may be in the cases if you are taking any kind of drugs, so you need to avoid the pregnancy, especially if you are taking isotretinoin or any other kind of immunosuppressives have been given to you. You need to avoid pregnancy, so this education must be given. What is the medicines which are given? We usually prescribe topical agents like benzoyl peroxide or retinoids or retinide like drugs like adapalene and tretinoin. we give systemic antibiotics like tetracycline, clindamycin, erythromycin. Comedone extraction can be there if there are big comedones. We have chemical peels, which are very common. Chemical peeling is utilized mostly nowadays for especially all kinds of skin. In case of acne rosacea, laser treatments may be helpful in removing these problems. Then the next important problem is dermatitis. Dermatitis means inflammation or infection over your skin. It is of two types: irritant, which may be because of irritation, and allergic is because of any allergen. Your non-allergic reaction may be due to mechanical irritant, chemical irritant, or biological irritant, and your allergic dermatitis may be of due to some poison ivy, industrial, occupational, or cosmetics. Second type is atopic dermatitis. First, we discussed about contact dermatitis. This is the first most important type of dermatitis. Second is atopic dermatitis. See the kind of rash or the inflammation that is present over the skin. It is a genetic disorder. It is not related to any specific allergen. When any irritant comes in contact, your body itself causes the problem, and it is genetically involved. It is common in children. Risk factors may be diseases like asthma, hay fever, sudden changes in temperature, exercises, stress, and so on. Presence of certain immunological irregularity and inflammatory mediators may also be there. Skin becomes rough and dry. Vasodilation due to heat and humidity increases the inflammatory response. Lesions are usually present in one place. There may be fever, lot of itching, inflammation, lots of secondary infections may also be there. Then next, or the third important type is lichen simplex chronicus. In this, there is localized circumscribed eczematous eruption, that is purple shaped eruption you can see, which usually occurs when you scratch or rub the skin a lot. Itching may be present. Skin becomes excoriated and thickened, and the plaques, as you can see, appear. Then there may be seborrheic dermatitis. See so many scales on the patient's head, and the area where there it is present, the hair in that area have already gone. So there is chronic non-infectious inflammatory reaction which is caused by stress, infection, cold weather, and hormones. It is common in neonatal and post-pubertal age groups. Cause is usually unknown. Lesions are pruritic, erythematous, greasy, and scaly, and in this case, secondary infections may also occur because such kind of infection or getting away with the skin, it causes a break in the skin which causes more infections to hover over the place and increase in the chances of secondary infections. The other two types of nummular and stasis dermatitis. Nummular is just a redness over the place, concentric circle, seen in middle-aged and older adults, and these lesions are usually 4 to 10 centimeter in their size. Status dermatitis is eczematous eruption, and it is preceded by varicosities and poor circulation. Skin becomes bulky, lot of scales are present. What is the management? Crusts and scales are not removed, but they drop off naturally. Corticosteroid, oral antibiotics, antihistamines, and antipyretic agents can be used. Oatmeal baths can be prescribed. Immunodilators like tacrolimus can be utilized. Occlusive moisturizing agent can be used many times a day. Phototherapy with UV light is very important. Coal tar preparations can be utilized on the nightly basis. Anti-seborrheic shampoos which contain selenium sulfide can be utilized. Elevation compression stockings and Una boots, if there is edema in the skin, can be prescribed by your doctor. Steroid preparations for the scalp can be utilized. After the dermatitis, we have skin infestations. Just naming a few, there are scabies, there is pediculosis, and there is Lyme disease. Scabies usually occurs over the skin, as you can see. Pediculosis is the skin infection with the lice. It occurs in the head, in the body, as well as pubic areas. Lyme's disease is caused by tick bite. So these are all skin infestations. What happens in skin infestation is that you need to use anti-scabies creams and they have to apply it at the bedtime. You need to remove the medicine after prescribed time with soap and water. Antihistamines or topical steroids need to be utilized. Secondary infections are treated with antibiotics. Family members and close contacts should be treated side by side. Directions for the application of medicine should be properly followed. Underclothing and linen should be properly washed, dried, and then utilized. The clothing and bed linen of the patient should be washed separately than the other members of the family to avoid exchange of infection. Symptoms of itching may persist for up to 2 weeks after treatment, so patient has to be told. We have alopecia, another kind of problem which is also growing nowadays. Loss of hair, that is ganjapan, and it may be due to various genetic factors, various disease process and aging process. The one and the most important is starting with this alopecia areata. As you can see, it is most common. There are round patches or circular patches over the head. See, we can see round patches. Alopecia totalis, totally all the hair is lost. Alopecia universalis, all round, even the body hair is lost. Then androgenetic alopecia, especially in males, either there is M-shaped baldness or there is baldness on the head, that is circular type. Then we have female baldness. In the female pattern baldness, we have hair thinning all over, baal patle ho jana. Then we have traction alopecia, that is the hair are so thin and they are so weak that even if slight pressure is applied, like combing the hair or when you apply rubber and you remove the rubber, the hair go away. This is your traction alopecia. So, risk factors, we know it can be scarring, radiation, your own body immunity may be low, there may be lots of infection, genetic is also one of the reason. Scarring may also cause permanent and irreversible hair loss. If there are other infections of the skin that are affecting your head, like dermatitis and all, they may also lead to this problem. Other diseases like systemic lupus erythematosus, thyroid diseases, pituitary diseases can cause. Androgenic reasons in postmenopausal women and men can be present of increasing age. Drugs like thallium, retinoids, anticoagulants, and oral contraceptives, propranolol, and many other drugs can also lead to this. Even chemotherapy can lead to alopecia. Your radiotherapy may also have an impact on your hair. Next is vitiligo. Vitiligo is a kind of pigment disorder in which there is half. There is a normal skin coloration and the other part of the skin is very light colored. There is depigmentation because your melanocyte, that is the cells which give color to your skin, they have been lost. The lesions are present. The commonly affected areas are skin over your bony prominences and which are sun exposed. Usually there are no symptom, but the pigment loss is progressive. Over the time, slowly it starts, and over the time the whole skin gets involved. There are two kinds of problems we usually see: vitiligo and albinism. Vitiligo means an autoimmune disease which affects as patches of white skin over your normal skin color. And in this vitiligo, we have white color and normal skin color would be there, and it appears as smooth white patch. But in case of albinism, your total body is white color, including your hair. In vitiligo, your hair is not effective. So these are two skin problem one needs to differentiate nicely. And your albinism is a genetic disorder. Genetic disorder is a disorder which affects your chromosomes and genes. Autoimmune disorder is the one in which your body recognizes your skin as a foreign material and impacts it. So, in vitiligo, your whole body becomes white and it can also affect your eyes, but this does not occur in vitiligo. So, what is the management? We can have a potent corticosteroid used, that is clobesterol sol, which is applied to the localized area to stimulate that the color can be regained. Repigmentation sometimes can also be achieved with the help of UV radiation, or you can also utilize other kind of methods if it is very extensive. We can try to depigment the areas which are of normal skin. Like for example, if there are only few rashes, we can try to restore their color. But if there are lot of rashes and your normal skin appears as patches, we will try to reduce the pigment of those normal skin so that the whole skin becomes one colored. Topical application of hydroquinone or 20% monobenzyl ether may also help to depigment any darker skin. We need to be alert for sun sensitivity in these patients and increased risk of developing skin cancer, which is very common. Now, coming to the last part, what is the general nursing management? So, first and the foremost diagnosis is the skin integrity is lost because of infection or the disease process. We need to assess the skin and note its turgor, texture, color, its changes. We need to assess the skin for lesions, macule, papule, and discharges. We need to get the history. What is the usage of the soap, perfumes, how often they are being used, what what is their ingredient so that they might not be affecting. We also need to have the history about the genetics of this person or any other disease he was affected from. We can also schedule diagnostic tests for these patients. Ask the patient to use lukewarm water and avoid using any harsh soaps. Warm salines, cold compresses as told by their skin physician. And we need to prescribe drugs and give prescribed drugs as the skin care products and lotions would have been prescribed in the prescribed dose and at prescribed time. We need to tell the patient to avoid extreme cold, hot temperatures and wear proper clothing. Usually, we tell the patient to wear cotton clothing and avoid any synthetic clothing because cotton clothing for skin disorders is the best and can be washed and dried also very easily. We need to ask the patient to maintain health of the skin and the oral mucosa. We also need to tell the patient and help the patient in assisting in various therapies like comedone extraction, UV therapies, oatmeal baths, and all which have been prescribed for each kind of skin infection and problem, and we need to care for these patients. Next is risk for infection and injury. We know the skin has broken down, there are lots of problems, there may be many secondary infections, so we need to help the patient. We need to check him regularly for the signs of infection. We need to get any antibiotic prescribed, and if the same has been prescribed, they can be given to the patient. Antifungal corticosteroid therapy based on the patient's diagnosis can also be given to the patient as prescribed for the patient. Then we need to tell the patient to avoid rubbing, itching the area, to avoid any kind of bleeding, especially in patients of psoriasis. If there is lysis, that is pediculosis is there, we need to utilize, tell the patient to wash hair regularly, need to take care of his hair, and also the various steps by which the infection can be controlled for further spread. Another important thing that we need to do in order to avoid the spread of infection is to ask the patient to maintain his hygiene, maintain the temperature of water, and also to maintain aseptic technique when, as a nurse, we are caring for the patient. Then next is most important diagnosis is impaired comfort. Patient is not comfortable when he has a skin problem. He's always itching, he's always feeling inflammation, there's always redness. So we need to ask the patient to use the lotions, creams and talcum as per his condition. We need to tell him to drink adequate fluids so as his skin remains hydrated. Tell him to utilize moisturizers and the skin ointments as prescribed. We also need to assess his pain level so that the pain does not increase, and we are trying to decrease his pain in such a case. If there is disturbed body image because the patient may be suffering from psychological problems, he may be feeling, oh, my body has changed, what to do, everybody looks down upon me, everybody thinks what has happened to me. So we need to give him psychological support. We need to reassure him that over the time this is going to change if there is infection. But if there is a genetic problem which cannot be changed, we need to counsel the patient so that he is able to maintain himself and is able to have a positive self image, positive body image, especially in teenagers and women, where all these problems lead to a lot of psychological problems. Then we also need to assist and educate the patient in enhancing their outlook and the body image about self. And we also need to talk to the patient about expressing his own feelings. Last is, what is the nursing diagnosis? We have deficient knowledge. In this case, if the patient has deficient knowledge, we need to provide the patient education and advices. I have already told you there are various advices that you need to provide the patient. You need to inform him about his hygiene. You need to inform him about his clothes, what kind of material it should be. It should be cotton. How do you wash it? How do you dry it? How can you keep your nails trimmed? How you should not scratch any area and then touch the other area? How you as a nurse can also help the patient maintain asepsis at his home? How you can also tell the patient how to utilize the various pharmacological therapies that are being prescribed. That is, you need to provide information about the pharmacological therapies. There are plenty of pharmacological therapies. For psoriasis, we have about 10 to 12, a whole therapy of various agents, corticosteroids, dianthrol compounds, immunosuppressives. We need to tell the patient what are the side effects of these medicines that are being given. There may also be some medicines which reduce the immunity, but patient may have development of secondary infection. How the patient can deal with these secondary infection? He needs to keep himself away from infections like coughing patients, other patients having cold and all, so that he does not catch an infection and it does not increase. Over the time in the past two years, we have realized that COVID-19 and other such respiratory infections can be spread very easily. So especially in the patient who is being given immunosuppressive drugs and has low immunity, how can a patient try to avoid other sideline infections so that the things do not complicate? We need to educate the patient about hygienic methods, how he can clean, how he can avoid transfer of infection from one place to another, from one body part to another. We also need to provide the information about the surgeries and the various therapies. I have already told you there are various surgeries, like for acne, we have comedone extraction. We have certain surgeries for psoriasis, certain extractions may be there. Then for pediclosis on all, we may utilize certain extractive methods. That has to be utilized and told to the patients. Special therapies. Special therapies include the therapies like UV therapy and other related light therapies. So, how that can be utilized and how other side effects can be removed. So, this education point is very, very important for these patients, because usually we give the medicines and send the patient, we do not educate them. There are plenty of side effects, there are plenty of effects also which have to be talked and told to the patient. So today in the class, we learned about, in this session we learned about plenty of things, different types of skin disorders, how do we manage these skin disorders, how do we educate the patient about this skin disorder, what is the responsibility as a nurse, how can you help patient have proper physical, psychological, spiritual and social health so that they do not suffer from any problem. This is what we discussed today. So, with this, we come to the end of an important topic about management of patients with skin disorder. Hope you have learnt about various methods of helping the patient, educating them, and also providing medication and pharmacological therapies that were taught about. Thank you, and hope you have learnt many things from such a class.
Are you a fresh graduate? Do you want to fulfill your educational aspiration by pursuing higher education in various interdisciplinary and multidisciplinary areas like environmental science, environment and occupational health, philosophy, sustainability science, folklore and culture studies? If yes, the School of Interdisciplinary and Transdisciplinary Studies offers various programs like Master's Program, Graduate Program, Postgraduate Diploma, Certificate and Appreciation Program. The school offers 5 Master's Programs. Master of Science, Environmental Science. The eligibility criteria for MSc Environmental Science is Graduate in Science, BTech, BE, Agriculture Graduate, Forestry Graduate and Veterinary Graduate. School also offers Masters in Environment and Occupational Health, Masters in Sustainability Science, Masters in Philosophy and Masters in Folklore and Culture Studies. The eligibility criteria for these 4 Masters program is graduate in any discipline. School also offers various socially relevant and need-based PG Diploma program like PG Diploma in Sustainability Science, PG Diploma in Environment and Occupational Health, PG Diploma in Folklore and Culture Studies and PG Diploma in Migration and Diaspora Studies. The school also offers PG Certificate in Climate Change and Avshist Prabandhan mein Praman Patra. The school also offers 2 doctoral programs, PhD in Environmental Science and PhD in Interdisciplinary and Transdisciplinary Studies. The school offers various innovative technologies and multimedia for providing a very excellent student support system. The study material
Hello and welcome to the session. In this session, we will be discussing about analysis of polynomial evaluation algorithms. In order to do so, we should have a method of evaluating or analyzing these algorithms. The method which we would be using for analyzing these algorithms is going to be big O notation. Now, why big O notation for this particular case? Well, this big O notation uses a notation of upper bounds or a worst case bound on an algorithm. So that is very useful in that particular context. It finds the maximum number of steps to solve a problem. So once again, the higher side. It bounds the growth of the running time for large value of input sizes. And it notifies that a particular procedure will never go beyond a specific time for an input size n. And finally, it makes algorithms much easier to analyze since we can conveniently ignore low order terms. In a sense, what we are basically trying to see that what is the way we are trying to find out what is the highest amount of time which may be required to evaluate a polynomial or worst case time in that particular sense. And for that, big O notation is going to be really, really useful. And this basically is an asymptotic notation. That is why it is giving us the upper bound. Now, once we know this is the method which we are going to use for analysis of algorithms, then what we are going to do next is, what is polynomial evaluation? Well, in order to understand that, let us define the term polynomial. So, a polynomial is an expression that contains more than two terms. A term comprises a coefficient and an exponent, and there are two examples given where we are saying 15x to the power 4 plus 7x square plus 9x plus 7. This is one polynomial. It is of degree 4, and there is another polynomial which is also of degree 4, which is 14x4 plus 17x cube minus 12x square plus 13x plus 16. So there can be number of polynomials, right? Our purpose is to evaluate a polynomial. But in order to evaluate an algorithm on polynomial, we need to know how these polynomials are going to be represented in a computer system. Only then we can make out the algorithm for that particular polynomial. Well, in order to represent polynomial, we normally use two basic techniques, either the arrays or the structure, which is normally the case. Now, if we are using a structure, then in a structure representation, polynomial contains two parts. So each polynomial, as we saw, a polynomial consisted of coefficient and its corresponding exponent. So if we can represent these two things in one structure. Okay, so you can look at the slide and you can make out that, okay, this is the way polynomial can be represented with the help of a structure, where we are saying polynomial, it is integer coefficient and integer exponent. But remember one thing, this structure is representing only one term of the polynomial. So the complete polynomial will be basically linked representation of this. However, a polynomial can be represented in a very, very simple way using an array. You just need to record the coefficient value, right? And you can declare an array of size 0 to n. Suppose n is the order of the polynomial, then 0th coefficient is basically the constant value within the polynomial. So this is the way you can represent the polynomial. Fine. Now the next thing is, what are the different methods of evaluating a polynomial? Well, they can be, as far as computers are concerned, there are two simple ways of evaluating a polynomial. First, the brute force method, and the second is the Horner's method. Now, there seems to be, the name basically communicates the brute force method, right? So basically you will be taking each term, solving it, and then coming up with the solution, right, and adding all those things. Well, if you see the polynomial evaluation here, okay, here we are showing, and to evaluate the polynomial px 15x to the power 4 plus 17x cube minus 12x square plus 13x plus 16 being the constant term. Now, how exactly the brute force method is working? In the brute force method, we will simply find, so what you really need to do, you need to find out the value of this particular polynomial at a given value of x, right? So if I want to do that, so what I'm going to do, simply I'm going to multiply x 4 times, because this is what x to the power 4 is, and multiply it with the coefficient, right? So this is how the first term would be evaluated. Then the second term would be evaluated. Similarly, x cube here, so that is why we are multiplying it x 3 times, and the coefficient 17. Now here you can see we have multiplied it with 12x and x square. This is 13 into x, and this is just constant, and we add all these values, we get the value of the polynomial at, say, whatever x value which you might specify. So this is the brute force method. However, we will find out later on that this brute force method is not very computationally good. It is going to be very, very expensive, computationally expensive. Therefore, a method designed by Horner was designed to evaluate a polynomial. Now this seems to be a very interesting combination, because what now is being done, that we are evaluating 15x plus 17, right? Just 15x plus 17 in the first term or first evaluation, right? Then we are multiplying, the result 15x plus 17, we are multiplying with x, and then we are moving to minus 12, this particular constant. So 15x plus 17 was coming from here, right? So 15x and 17, the coefficient of this x cube term, and then here it is being multiplied by x completely minus 12, that is the next coefficient. Then once again this complete stuff is multiplied by x plus 13, which is this coefficient, and finally it is added 16. So are they equivalent? Well, you can very well verify 16. So this coefficient is there, then x, so we go backward, so we get 13x over here. Then we multiply it, what we get is x square in this particular place, so it becomes minus 12x square, right? And then once it at this particular place it becomes x cube, so 17x cube and 15x to the power 4. So you can see that this particular evaluation is same as far as the output is concerned, but the method is somewhat different, right? Because now we are multiplying, first multiplying, okay, and then the result of first multiplication is then multiplied with x once again, like that. Okay, now remember one particular thing. Whenever we are evaluating any mathematical expression, suppose there is a plus operator and there is a multiplication operator. Well, the cost of plus operator is much lower than the multiplication operator. Therefore, multiplication operator is the one in general. If we are having just plus and multiplication operator, then it is the multiplication operator which is going to control the analysis of that particular algorithm. So let us now evaluate these algorithms, right? Because that is what our prime purpose is, how these particular algorithms are performing. So let's go into, so now you are clear about the process of what we do. So this is polynomial evaluation. But before we go to that particular evaluation stuff, let us try to understand what problem we are trying to define or what problem we are trying to solve using the computer. Well, the problem which we are going to solve is, given a polynomial, and this is a very generic polynomial which is of degree n with the coefficient an and x to the power n plus a n minus 1 and so on and so forth, right? And a x to the power 0, which happens to be the constant value, where a0 to an are the coefficients of the polynomial, n plus 1 coefficients you can see. For a degree n polynomial, you have n plus 1 coefficients, and x to the power 0 to x minus x to the power n are the related exponent. X to the power 0 we all know is 1. And the problem is to evaluate the polynomial at a specific value for x. So you will assign a value x in the polynomial, and that is what we are going to expect, or we are going to expect some result. What methods we are going to use for this? Well, the method we have already specified. Either we are going to use the brute force method or we are going to use the Horner's law. And which one is more efficient? That is what is the concern. So let's look into the analysis of brute force method. Well, when we go to analysis of brute force method, each term of polynomial is evaluated one by one. That is what we have seen. First, you will be evaluating x4 terms, right? So you will multiply x 3 times, right? X into x once, x into x into x 2, and into x. So 3 multiplications, right? For x to the power 4. First, compute x to the power n. So how many times you will be computing this x to the power n by multiplying x with x? N minus 1 times. and then this resultant value will be multiplied with the coefficient an. So in terms, total number of multiplications are n in this particular case. Now you will repeat the same step for other terms and compute the sum. So here we are doing how many computation? N multiplications. With a n minus 1, how many multiplication? N minus 1 multiplication, because the power a n minus 1 x to the power n minus 1 is going to be there. With a n minus 2, you will have n minus 2 multiplication, and the last two terms you can see we will have just here we have 2 multiplication, here we have 1 multiplication, and this is just a constant, right? So this is what we see as the total number of multiplications. So once we know the total number of multiplication, let's try to figure out what are the number of multiplication in the worst case. So worst case is going to be when all the terms of polynomials are there. X to the power n, x to the power n minus 1, there are non-zero coefficients for each of the term. So this is going to be our worst case. So let's look into for the worst case. For the worst case, what we are going to get is that this Tn equals to, that is the time for evaluation of polynomial, and this is in terms of number of multiplications. So in the first, that was for the first term, we had to do n multiplication, and this term is actually a to the power a n x to the power n. So you have n multiplications over there. Then n minus 1 multiplications for the second term you get, okay. N minus 1 why n minus 1 multiplication? 1 multiplication with the coefficient, and n minus 2 multiplication of x within them, because the power is x to the power n minus 1. Likewise, you will move on till 2 and 1. Now, can you notice this is typical an AP with the difference of minus 1? Right? If you know AP, right, arithmetic progressions, right? So this basically is representing a arithmetic progression. And what is the sum of arithmetic progression? Where you have n terms, it is n into n plus 1 by 2. So this is precisely what you are going to get, n into n plus 1 by 2. Now, so the worst case of brute force method, this n into n plus 1 by 2, if I say it is going to be what order? The asymptotic order for this particular case is going to be order of n square, because that is what n square by 2 is going to be the first term, plus n by 2 is going to be the second term. So and in the asymptotic notation of order, we will simply ignore the constants and the division one, and technically we came up with order n square. Now, order n square just for polynomial multiplication, it seems to be very, very cumbersome. It is very, very expensive, right? And can we do better? And probably that is why the Horner's rule has been created, or Horner's method has been created. So once again, we look into the polynomial evaluation. The Horner's method, we are evaluating subterms, right? One term, right? Then multiplying it with x and like that. So whatever we have done, this multiplication is reused here. You don't have to do this particular multiplication again. And that is the essence of the Horner's rule, right? So let's see exactly what kind of algorithm Horner method would have. In case before we see the algorithm, let's look into the basic that is pseudocode, right? And then we look into the algorithm thereafter. So if I say Horner method have 3 variables, A happens to be the array, right? And this array will be representing the array of coefficient, n happens to be the degree of the polynomial, and x happens to be the value at which the polynomial is getting evaluated. Now, the important comment which is over here is the polynomial is represented as an array of poly, we are just naming it poly, of n plus 1 elements, right? Why? Because we have how many coefficient? 0 to n, right? So they are n plus 1 coefficient, which are coefficients of the polynomial of degree n. So how we are going to proceed in this particular case? First, we will use a variable p and assign it the nth coefficient, which happens to be an. Right. So this is the nth coefficient of the nth term, which is an. Set I equals to n minus 1. So now we will proceed with the value of n minus 1 and compute p into x, right? Now in this particular case, what we are computing? An multiplied by x plus poly I in this particular becomes the coefficient of n minus 1, because I is n minus 1. So what I am computing efficiently is an into x plus an minus 1. This was precisely the first term of the Horner's rule, which or Horner's method, right? And then we decrease I minus 1. So now this will become the value p, and then n will become n minus 2, and the next computation is going to be this whole term multiplied by plus into this whole term multiplied by x plus n minus 2, like that. Okay, so we will keep on repeating this particular step till the final polynomial result is achieved. Now, what is the algorithm for this? Now, this you can convert into a very, very simple algorithm. Okay, where the input is an array a0 to n of coefficients of a polynomial of degree n, and a point x at which you are wanting to evaluate the polynomial. The output is the value of polynomial at a given point x, right? And the function name we have given evaluate Horner. You can give it any name. A and nx are the 3 parameters, just like the algorithm, and we assign p the value of the first an, right? So this is what it is representing, small an. That was the coefficient of the nth term, or x to the power n, right? And for I equals to n minus 1, where I is less than 0, okay, till I is less than 0, keep on decreasing I minus 1, and what you are computing is the value of subterms, that is p into x plus a, I, and so on. And what you are ultimately returning? You are returning the value of finally evaluated polynomial. So let's look into the complexity analysis of polynomial evaluation using the Horner's rule. Well, a polynomial of degree n is evaluated as, how we are doing it? There is an initial assignment, and what we are doing in that particular initial assignment? We are assigning the value of an, okay, to p. After the first iteration, what we are getting? P equals to an, that was this particular an we are referring to, multiplied by x, plus what we were adding in this particular thing? The coefficient of n minus 1th term. Why? Because we were we initialized I to be n minus 1. So this is what was added because of that, and what we got is the polynomial value as an into x plus an minus 1. So what we do next? We do after the second iteration. Now we move to the second iteration. What we got? This was the result of first iteration. That was this particular p. Now we are multiplying it with x and adding the n minus 2, because now in the second iteration I is reduced to n minus 2, right? So every subsequent iteration uses the results of previous iteration. This was the result of previous iteration, and multiplies the previous value of p, and then adds p with x, and then adds the next coefficient. So with this previous iteration value p, and multiplies it by x and adds the next coefficient into it. So this is the way the Horner rule is working. So once the Horner rule has determined this, so after n iteration, what you are going to get? Well, after n iteration, you are going to get the final polynomial evaluation which we are going to, or which we expect, that is an into x plus an minus 1 multiplied by x plus an minus 2 into x, and so on so forth, where till plus a2 then multiplied by x plus a1, right, and the bracket closes here. Once again we multiplied it by x, and final a0, which is not to be multiplied by with anything. So this is the required correct value. So first proof which we are able to do, or we are able to ascertain here, is that the Horner's method is working correctly. That is also very, very important to know, that the Horner's method has worked correctly. Then the initial assignment takes constant time. It is just an assignment because we just assigned an right to the polynomial value, and each of the subsequent n iteration is order 1 only. Why? Because there is just one multiplication and one addition, right, as it includes one multiplication, one addition and one assignment, which takes constant time. Hence the total time complexity of algorithm will be order n. How? How is it possible that it is order n only? Well, if you look into this particular slide now, this is our polynomial evaluation. The first, as we said, takes one multiplication, second one multiplication, third term also take one multiplication. All terms will take only one multiplication. So in the worst case, what will happen? The time taken is going to be summation of how many terms are going to be there? N terms. So 1 plus 1 plus 1, how many times? N times. So how many terms you have? N terms, and summation of n terms is obviously n. So the order in this particular case happens to be n, right? And the order or big O notation in the big O notation was n square in the brute force method. So which method is supposed to be faster? Well, the worst case complexity is one of the most used. So in summary, what we can say, the worst case complexity is one of the most used complexity criteria. The brute force polynomial evaluation is of order n square, while Horner's rule order is just of the order of n. Therefore, what we can safely conclude, that the Horner's rule is a good choice when we want to do polynomial evaluation. Therefore, in practice, right, we are going to utilize Horner's rule. Why? Because the Horner's rule is giving us much better results. You may argue that ultimately it was n into n plus 1 by 2 only as far as polynomial evaluation with brute force is concerned. The worst case was only order, we gave it an order n square. But technically, when as the value of n increases, the value of n square increases very, very fast, despite it is being divided by 2, right? So that is where the order of n is much better than the order n square. And if you are evaluating a polynomial of order of degree 100, then obviously you will be preferring the Horner's method. With this, we come to an end of this particular session. Bye for today.
Do you wish to be part of a television studio like this or any other media system? Or already part of any media system, want to enhance a new set of skills? Welcome to School of Journalism New Media Studies. Here in the School of Journalism New Media Studies, we are offering program for all set of people to learn and enhance their media skills. The vision of School of Journalism and New Media Studies is to generate a new set of professionals in the area of media and communication studies with understanding about role of media in the national development and global understanding. We offer innovative programs in the field of journalism and mass communication that sets the benchmark of high quality learning and teaching process at the national level. We offer these programs across the country with the help of our regional network as well as study center. Same manner, many of our programs are offered through online mode with a sophisticated learning management system. SOGNMS offers programs from PhD in journalism and mass communication till certificate level. We have masters in journalism and mass communication. The eligibility is bachelor's degree, and we are introducing this program in 3 languages: Hindi, Tamil and English. Students from national and international students can join either through online mode as well as in a distance mode. We have 4 postgraduate diploma programs, specialized areas in the field of development communication, digital media, electronic media and journalism and mass communication program. And all these 4 programs are available in distance mode. 2 programs are available in online mode, development communication and digital media. And we have specialized certificate program in community radio. IGNOU employs various media and communication tools for better teaching and learning process. School of Journalism and New Media Studies utilizes this media system for delivering all our programs. Come and join with us for exploring a new career and enhance your media skills.
क्या आपको याद है कि आपने अपना अंतिम पत्र किसको लिखा था या क्यों लिखा था? क्या वो पत्र औपचारिक था या अनौपचारिक? उसकी शैली कैसी थी? उसमें किस प्रकार की भाषा का आपने प्रयोग किया था? क्या वो पत्र अंग्रेजी में था, हिंदी में था या संस्कृत में था? आज इन्हीं सब विषयों पर चर्चा करने के लिए हम सब यहाँ एकत्रित हुए हैं और हम जानेंगे कि पत्र लिखन की शैली और भाषा ये दोनों किस प्रकार की होती हैं। अपनी पिछली कक्षाओं में हमने चर्चा की थी कि पत्र जो है वो 2 प्रकार के होते हैं, अनौपचारिक और औपचारिक। अनौपचारिक पत्र का एक और नाम क्या था? व्यक्तिगत पत्र, जिसे अंग्रेजी में पर्सनल लेटर कहते हैं, और औपचारिक पत्र जिसको ऑफिशियल लेटर कहते हैं। तो इन दोनों में क्या भेद है यह आप जानते हैं। इन दोनों की में किस प्रकार की भाषा का प्रयोग किया जाता है ये भी आपको थोड़ा बहुत हमने बतलाया था, लेकिन इन दोनों की शैली को लेकर कितना भेद या साम्य परस्पर प्राप्त होता है यह आज हम जानने का प्रयास करेंगे। तो शुरुआत करते हैं अनौपचारिक से। तो अनौपचारिक जो पत्र है जिसको हम पर्सनल लेटर कहते हैं, उसमें जैसा कि मैंने आपको पिछली कक्षा में बताया था कि उसके विषय को लेकर हमें अत्यंत विविधता देखने को मिलती है। उसका विषय अत्यंत व्यक्तिगत होता है, इसलिए उसमें कोई बंदिश, कोई कट्टरता उसमें आपको देखने को नहीं मिलेगी। लेकिन प्रत्येक पत्र की अपनी एक शैली होती है, उस शैली का ध्यान रखना हमारे लिए परम आवश्यक है। भाषा, जब हम किसी पत्र की शैली और भाषा दोनों पर विचार करते हैं तो शैली से तात्पर्य हुआ कि कोई भी जो पत्र है उसमें उसकी तिथि किस तरफ हो, उसमें आपका नाम किस तरफ आए, जिसको आप पत्र लिख रहे हैं वो आपके बाईं ओर हो उसका नाम या दाईं ओर हो। यदि व्यावसायिक पत्र है तो उसमें क्या किन नियमों का आपको पालन करना चाहिए, ये सब जानना बहुत आवश्यक है। और उसके बाद जो दूसरा बिंदु है वो भाषागत है। तो पहले हम शैली पर विचार करेंगे, एक एक करके हम औपचारिक पत्र की शैली पर बात करेंगे, उसके बाद भाषा पे बात करेंगे और फिर अनौपचारिक पत्र की शैली और भाषा पर बात करेंगे। तो आप देखिए, पहला हमारे पास जो बिंदु है वो है अनौपचारिक पत्र की शैली का। जो पहला बिंदु है कि अनौपचारिक पत्र या जो व्यक्तिगत पत्र है उसमें लिखने वाले का जो पता है और पत्र लिखन की तिथि पत्र के सबसे ऊपर दाईं ओर लिखी जाती है। यानी कि पत्र का जो आपका राइट हैंड साइड है उस पर आपको लिखने वाले का पता और तिथि आपको देनी है। ये पहला बिंदु आपको ध्यान रखना है। किस प्रकार के पत्रों में? अनौपचारिक पत्रों में, जैसे व्यक्तिगत पत्र, जैसे पर्सनल लेटर आप कहते हैं। ये पत्र चाहे अंग्रेजी में हो, चाहे हिंदी में हो, चाहे संस्कृत में हो, शैली की दृष्टि से तीनों पत्रों में समानता आपको देखने को मिलेगी। भाषागत दृष्टि से आप इसमें विविधता पाएंगे। तो यदि आप संस्कृत के माध्यम से पत्र लिखना जान रहे हैं तो आप ये समझिए कि आप हिंदी और अंग्रेजी में भी आप पत्र लिखना सीख रहे हैं। भाषा का चुनाव आपके हाथ में है, आपको किस भाषा में पत्र लिखना है इसका चयन आपको करना है। जैसा कि मैंने आपको बताया था कि यदि आप किसी संस्कृत विश्वविद्यालय को पत्र लिख रहे हैं या किसी संस्कृत पत्रिका के संपादक को पत्र लिख रहे हैं या किसी संस्कृत महाविद्यालय के प्राचार्य को पत्र लिख रहे हैं, कहीं आवेदन कर रहे हैं, उस समय आपको यदि संस्कृत में पत्र लिखने को कहा जाए या लिखना आवश्यक हो तो उस समय शैलीगत दृष्टि से किन किन बिंदुओं का आपको ध्यान रखना चाहिए ये आप यहाँ जानेंगे। तो जैसे कि आपको पता चला कि आपने बताया कि पत्र लिखने वाले का पता और पत्र लिखन की तिथि आपने सबसे ऊपर दाईं ओर लिख दी। उसके बाद बाईं ओर यानी कि आपके उल्टे हाथ की तरफ पत्र प्राप्त करने वाले हेतु के लिए आपको संबोधन देना है। संबोधन से क्या तात्पर्य है? उसका नाम लेना है या उसका पद नाम लेना है। और यह संबोधन जो है वो अत्यंत व्यक्तिगत होता है। तो यहाँ पर जो पर्सनल लेटर में हम पद नाम तो नहीं दे सकते क्योंकि यहाँ पर ये हमारा व्यक्तिगत पत्र होता है। अब मान लीजिए कि हम किसी अपने दादाजी को पत्र लिख रहे हैं या अपने मामा के पुत्र को पत्र लिख रहे हैं, क्योंकि ये मेरे व्यक्तिगत पत्र हैं। तो मेरे मामा के पुत्र को यदि मेरे कज़न भाई को यदि मैं पत्र लिख रहा हूँ तो ज़रूरी नहीं है कि मैं उसका नाम लिखूँ। यदि उसका नाम दिनेश है लेकिन मैं उसको प्यार से गोलू बुलाता हूँ, या उसका नाम गौरव है उसको हम गोलू बुलाते हैं, तो हम वहाँ पर गौरव शर्मा इसके स्थान पर गोलू शब्द का प्रयोग कर सकते हैं क्योंकि ये मेरा व्यक्तिगत पत्र है। दादाजी को पत्र लिख रहे हैं, दादाजी का कोई नाम होगा लेकिन हम उनको नाम से तो नहीं बुलाते, तो हम वहाँ पे क्या लिखते हैं? आदरणीय दादाजी। ठीक है। तो इस प्रकार यहाँ पर हम ये जो औपचारिक पत्रों में हम प्राचार्य का नाम ना लिखकर जैसे प्राचार्य शब्द लिख देते हैं, उसी प्रकार अनौपचारिक पत्रों में, व्यक्तिगत पत्रों में हम किसी सम्मानित व्यक्ति का नाम ना लिखकर उसको जिस नाम से हम बुलाते हैं उसको लिखने की हमें पूरी छूट हमें व्यक्तिगत पत्रों में मिलती है। तो यहाँ पर भी हमें कोई चिंता की बात नहीं है। शैली की पहले हम शैली पे बात कर लें। तिथि हो गई, पत्र लिखने वाले का पता हो गया और अब संबोधन हो गया। आप उसको संबोधित कर रहे हैं, आप उसको नाम लेकर पुकार रहे हैं पत्र के माध्यम से। उसके बाद आप लिखेंगे अभिवादन के रूप में आप सबसे पहले किन किन शब्दों का प्रयोग जब संस्कृत का पत्र लिख रहे हैं तो कर सकते हैं। तो उसमें प्रणामः, नमो नमः, नमस्कारः, स्नेहाशीषः, शुभाशीर्वादः, चिरंजीव। अब चिरंजीव है, ये अगर कोई बड़ा व्यक्ति छोटे को लिख रहा है तो चिरंजीव शब्द का प्रयोग कर सकता है। शुभम भूयात आदि। इसके अलावा ये तो कुछ उदाहरण हैं, अगर आप चाहें तो इनके अतिरिक्त भी बहुत सारे शब्दों का आप प्रयोग कर सकते हैं। यदि छोटा है तो उससे पहले के जो मैंने आपको संबोधन बताए उसको आशीर्वाद देना है, नमस्कार करना है। समान यदि आयु का है तो किस प्रकार के संबोधन हम कर सकते हैं। छोटा है तो उसके लिए किस प्रकार के संबोधन का या आशीर्वाद का, या एक पत्र को आरंभ करने से पूर्व किन किन शब्दों का चयन हम कर सकते हैं। तो ये मैंने आपको कुछ उदाहरण बतलाई। उसके बाद पत्र की शुरुआत कुशलता के समाचार या पत्र पाने की सूचना अथवा पत्र पाने के संदर्भ जैसी किसी बात से आप कर सकते हैं। यदि आपने अपने बचपन में या सामान्य रूप से अभी पत्रों का व्यवहार उतना नहीं रहा जब से अंतर्जाल का समय आ गया है, परंतु फिर भी यदि मेल के माध्यम से अभी भी पत्र व्यवहार समाज में होता है या हार्ड कॉपी के माध्यम से भी पत्र व्यवहार होता है, जहाँ अत्यंत आवश्यक होता है वहाँ हमें हार्ड कॉपी के रूप में पत्रों को भेजना पड़ता है। तो यदि हम व्यक्तिगत पत्र लिख रहे हैं तो उसमें हम सबसे पहले जब हमने अभिवादन कर दिया उसके बाद हम व्यक्तिगत कोई बात लिखकर या कोई पिछली पत्र व्यवहार से संबंधित कोई बात है तो या कुशलता के समाचार के साथ कि आपका पत्र, हम सब यहाँ पर कुशलतापूर्वक हैं, आशा करते हैं कि आप भी सकुशल, परिवार सहित सकुशल होंगे। इस प्रकार के आपने, ये एक शैली की बात कर रहे हैं, ये शैली होनी चाहिए पत्र की। उसके बाद जब आप प्रमुख उस पे मुख्य बिंदुओं पर या कंटेंट पर जो पत्र के आते हैं, वहाँ आप सीधा अपनी बात को शुरुआत कर सकते हैं कि आपको जो भी बात कहनी है, जिस उद्देश्य से आप पत्र लिख रहे हैं। व्यक्तिगत पत्र में कई उद्देश्य आपके हो सकते हैं। हो सकता है कि आपकी कोई व्यक्तिगत, आपको कोई अचीवमेंट आपको मिली हो, या आपको कुछ शुभ समाचार अपने किसी मित्र को बतलाना हो, तो उसके लिए हम व्यक्तिगत पत्रों का प्रयोग आज भी करते हैं। इसके बाद आप देखते हैं कि जब आपने ये सब कर दिया, उसके बाद तब पत्र का मुख्य विषय, जब आपने अभिवादन कर दिया, पिछली किसी बात को आपने रेफरेंस दे दिया कि आपका पत्र प्राप्त हुआ था और आशा करता हूं कि आप सकुशल होंगे, मैं भी परिवार सहित सकुशल हूं। इसके बाद आप मुख्य बिंदु पर आ गए, तो मुख्य विषय के लिखा जाएगा उसके बाद। और उसमें अनौपचारिक पत्रों में मुख्य विषय के आकार पर कोई बंदिश आपको नहीं मिलती। जैसा कि मैंने आपको पहले भी बतलाया कि आपका पत्र जो है वो 2 लाइन का भी हो सकता है, 10 लाइन का भी हो सकता है, आधे पेज का, 1 पेज का, 2 पेज, 4 पेज, 10 पेज, जहाँ तक आपकी क्षमता है या जब तक आपकी बात कंप्लीट नहीं हो जाती है, आप उसको लिख सकते हैं। इसमें पेजेस को लेकर या शब्दों को लेकर कोई बहुत ज़्यादा बंदिश आपको नहीं मिलती, बशर्ते आपके पास लिखने का समय होना चाहिए और पढ़ने वाले के पास पढ़ने का समय होना चाहिए। क्योंकि व्यक्तिगत पत्र हैं तो हो सकता है आपके भाव ज़्यादा हों, या आप 6 महीने में एक बार पत्र लिख रहे हैं, कहीं आप दूर दराज किसी दूसरे देश में हैं और किसी अपने दूसरे संबंधी को पत्र लिख रहे हैं, तो उसमें कोई भी ऐसी आपको बंदिश नहीं मिलेगी। ये बात इसलिए बताना आवश्यक है क्योंकि जब हम औपचारिक पत्रों की बात करेंगे तो वहाँ आपको शब्द सीमा को लेकर विचार करना पड़ता है, वहाँ आपको बंदिश मिलती है, हम आपको एक लिमिटेशन का ध्यान रखना पड़ता है। लेकिन पर्सनल लेटर्स में आपको इस प्रकार की कोई लिमिटेशन का ध्यान रखने की आवश्यकता नहीं है सामान्य रूप से। आप, लेकिन अब ये डिपेंड करता है कि आप लिखने के लिए आपके पास समय होना चाहिए बस लिखने का, और पढ़ने वाला उसको पढ़ने को राजी हो। इन चीज़ों का ध्यान रखना है। और पत्र के अंत में प्रायः एक बार फिर से अभिवादन होता है। एक बार आपने आरंभ में अभिवादन कर दिया और एक बार पत्र के अंत में आपने फिर से अभिवादन करते हुए उनको नमस्कार कहा। अब पत्र के दाहिने ओर, यानी कि पत्र के राइट हैंड साइड में, आपको पत्र लेखक अपना हस्ताक्षर करता है, यानी कि अपने साइन करता है। और हस्ताक्षर से पूर्व वह क्या लिखेगा? स्वनिर्देश, यानी अपना निर्देश लिखेगा। जैसे कि संस्कृत में यदि पत्र लिख रहे हैं तो क्या निर्देश हो सकते हैं? भावत्कः, भवदीयः, भवन्निष्ठः, भवद अभिन्न हृदयः आदि। यानी कि भावत का मतलब आपका, भवदीया मतलब भी आपका, भवन्निष्ठा जो आप में जिस मेरी निष्ठा है, मतलब आपका एक तरह से अनुयायी। या फिर भवद अभिन्न हृदय, यदि आप मित्र को पत्र लिख रहे हैं तो अभिन्न हृदय, यानी कि जो जिनके हृदय एक समान है। तो ये थोड़ा शास्त्रीय प्रयोग है, लेकिन इस प्रकार के 3-4 उदाहरण मैंने आपको दिए। आप इनके अतिरिक्त भी यदि कोई अच्छा नाम या अच्छा उदाहरण अगर आपके मस्तिष्क में है तो आप उसका चयन भी कर सकते हैं, लेकिन ये सब होना आवश्यक है। उसके बाद आप अपने हस्ताक्षर करेंगे, तो आप अपना बता कि आपका मित्र, आपका भाई, आपका भतीजा, आपका अपना, इस प्रकार का इनका भाव है इन शब्दों का। तो ये आपने पूरा का पूरा पत्र, व्यक्तिगत या जैसे अनौपचारिक पत्र कहते हैं, वो आपने देखा। लेकिन मान लीजिए कि आपने सारी बात लिख दी और आपने साइन भी कर दिए, भवदीयः इत्यादि सब कुछ लिख दिया। अचानक से आपको याद आया कि अरे एक इम्पॉर्टेंट बात तो मैं कहना ही भूल गया। तो अब बीच में अगर आप, कई लोग क्या करते हैं कि बीच में ही एक लाइन डालकर कुछ जोड़ने की कोशिश करते हैं। अगर आपको ऐसा नहीं करना है तो उसके लिए भी एक विकल्प हमारे पास है कि आप अंत में जहाँ आपने साइन कर दिया उसके बाद भी अगर कोई बात आपकी छूट गई है तो आप, लिखने वाले को बाद में कुछ याद आता है तो आप पुनश्च लिखकर उसे बाद में जोड़ दिया जाता है। आपने साइन कर दिया, आपको याद आया कुछ, आपने पुनश्च और कुछ भी रह गया है, और क्या, उसके बाद आपने वो वाली बात को आगे कंप्लीट कर दिया। तो इसमें भी कोई समस्या नहीं है। ये अनौपचारिक पत्रों में आपको ये पूरी छूट मिलती है कि आप इस सब चीज़ों में आप कर सकते हैं, कोई आपत्ति इसमें नहीं है। लेकिन अब पहले इसका एक उदाहरण भी, अब जैसे मैंने आपको अब तक जो बताया उसका एक उदाहरण भी हम देख लेते हैं। एक पत्र मेरे आपके समक्ष प्रस्तुत है यहाँ पर, जिसमें आप देखेंगे कि संस्कृत में पत्र किस प्रकार लिखा जाता है। जैसे आपने देखा कि दाहिनी ओर आपने अपना एड्रेस लिखा, आपने लिखा 145 145 सेक्टर 5 रोहिणी, दिल्ली 85, दिनांक आपने डाली, जैसा कि मैंने आपको बताया कि आपके दाहिनी तरफ दिनांक होनी चाहिए, पत्र लिखने वाले का पता होना चाहिए। उसके बाद संबोधन आप जैसे कर रहे हैं तो आप पत्र में देखिए आपने क्या संबोधन किया, श्रद्धेयाः तात कल्पाः शर्म महोदयः प्रणमांजलि निवेद्यते। पहले आपने उनको संबोधित किया, नाम लिया उनका, शर्मा महोदय, पूरा नाम नहीं लिया क्योंकि नाम उनका कुछ भी हो सकता है, दिनेश शर्मा, महेश शर्मा, लेकिन आप उनको शर्मा जी कहते हैं तो आपने शर्मा महोदय का प्रयोग कर दिया और उनको नमस्कार किया। उसके बाद आप, जैसा कि मैंने आपको बताया कि आप किसी पूर्व की घटना से संबंध बिठाते हुए भी आप बात को शुरू कर सकते हैं। जैसे इस संस्कृत पत्र में क्या लिखा हुआ है, भवद्भिः प्रेषितानि ग्रंथरत्नानि समासाद्य मच्चेतसि परमा प्रीतिर अजायत तद विषये स्वविचार विज्ञापनार्थम अहम यदादिष्ठः तन्नूनमेव मयि भवतां कृपातिशयत्वं सूचयति। एषु दिनेषु द्वयोः शोधपत्रयोर्लेखने अपरेषु च नैकेषु कौटुम्बिककार्येषु व्यापृत्तित्वात् आगामिनि मासे स्वीयवचांसि भवतां सविधे समर्पयिष्यामि। विचारः कियान् विस्तरो भवेद् इति कृपया ज्ञापयेयुः, चेन् महान् अनुग्रहो भविता। भवतां श्रीचरणेषु प्रणति पुरस्सरम। एक बार ऊपर अभिवादन किया है श्रद्धेय तात्कल्प्या, और एक बार नीचे पुनः उन्होंने लिखा हुआ है कि श्री चरणों में। इसका मैं हिंदी अनुवाद भी आपको बताऊंगा, पहले आप एक बार पत्र देख लीजिए। उसके बाद फिर आपने अपनी दाहिनी ओर क्या लिखा कि भवताम स्नेह भाग, जैसा कि मैंने भवदीयः भवतः ऐसा बोला था, आपके बाद उसने अपना नाम लिखा आशीषः। और अब उसको याद आया अचानक से कि कोई इंपॉर्टेंट बात छूट गई है, तो आप पत्र में देखिए उन्होंने फिर अंत में साइन होने के बाद फिर लिखा है कि पुनश्च एकम हर्षदम वृत्तम। कुछ याद आया, फिर बताया कि मदीयः एकः शोध ग्रंथः दिल्ली संस्कृत अकादम्याः दिल्लीस्था 20वीं शताब्दीयाः संस्कृत रचनाकाराः इति शीर्षकेण प्रकाशितः। ये पूरा संस्कृत का पत्र आपने देखा। अब यदि आपको ये जानना है कि ये इस पूरे पत्र का हिंदी अनुवाद क्या है, यदि भी जिन लोगों को संस्कृत आती है वो समझ गए हैं कि इस पूरे पत्र का भाव क्या है, लेकिन फिर भी यदि आपको जानना है तो हम इसका हिंदी अनुवाद भी आपके सामने रख रहे हैं। देखिए, इसी पत्र का हिंदी अनुवाद आपके समक्ष प्रस्तुत है, जिसमें आपने एड्रेस लिखा और ये सब तो समान रहेगा। हिंदी में आपने लिखा, श्रद्धेय पितृतुल्य शर्मा जी, प्रणाम। आपके द्वारा प्रेषित पुस्तकें पाकर मुझे असीम आनंद मिला। उन पुस्तकों के बारे में मुझे अपने विचार प्रकट करने का जो आदेश आपने मुझे दिया है, वह मेरे प्रति आपकी कृपा की अतिशयता का परिचायक है। मैं इन दिनों 2 शोध पत्रों के लेखन एवं अन्य कई पारिवारिक कार्यों में अपनी व्यस्तता के कारण अपनी बातें अगले महीने आपकी सेवा में प्रस्तुत करूंगा। मेरी बातें कितनी विस्तार से हों, इस विषय में अगर आप बताएं तो कृपा होगी। आपके चरणों में प्रणाम पूर्वक, और उसके बाद आपका स्नेह भाजन आशीष। और फिर आपको जो कुछ बात याद आई तो वो आपने जोड़ दिया कि एक सुखद समाचार आपके लिए मैं बताना चाहूँगा कि दिल्ली संस्कृत अकादमी की तरफ से एक पुरस्कार की घोषणा हुई है और उस पुरस्कार में मुझे स्थान मिला है। एक आपने अंत में एक बात और जोड़ दी। तो इस प्रकार का ये संस्कृत का एक अनौपचारिक पत्र का नमूना आपने देखा। ये पत्र यदि हिंदी में हो तो भी आप इस शैली का प्रयोग करेंगे, अंग्रेजी में हो तब भी आप इस शैली का प्रयोग करेंगे। भाषा का चुनाव आपके हाथ में है। तो ये अनौपचारिक की बात रही। अब हम इसकी औपचारिक पत्र की शैली पर बात करेंगे। अनौपचारिक हमने उसको चर्चा करने के बाद उसके एक पत्र का उदाहरण भी दे दिया। अब इसकी औपचारिक पत्र की शैली कैसे होती है, इस पर विचार करना आवश्यक हो जाता है, ताकि साथ ही साथ हम दोनों का कंपैरिजन कर सकें कि दोनों में कितना भेद या कितना साम्य है। तो देखिए, इसमें पहला बिंदु है कि औपचारिक पत्रों की शैली एवं लेखन पद्धति विशिष्ट और सुनिश्चित होती है। जैसा कि अनौपचारिक में था कि कुछ भी आपको कहने की छूट है, आपने उसको जो भी नाम से आपको संबोधित करना है वो कर सकते हैं, लेकिन यहाँ पर ऐसा नहीं होता है। यहाँ पर इसके जो नियम हैं, इसके जो पैमाने हैं, उन्हीं के अनुसार आपको पत्र लिखने की अनुमति होती है। यदि आपने नियमों में इधर उधर गड़बड़ की तो आपकी जो बात है, जो उसको आप संप्रेषित करना चाहते हैं, उसमें रुकावट आ सकती है। तो क्या बताया कि लेखन पद्धति विशिष्ट और सुनिश्चित होती है, पहला बिंदु। दूसरा बिंदु है कि प्रत्येक औपचारिक पत्र के लेखन की एक पृथक ही पद्धति होती है। पृथक माने अलग। अर्थात मान लीजिए कि अगर आप एक महाविद्यालय के प्राचार्य को प्रवेश आपको एडमिशन लेना है महाविद्यालय में, उस हेतु आप एक पत्र लिख रहे हैं, ये औपचारिक पत्र हुआ, ऑफिशियल लेटर हुआ, उसकी शैली अलग प्रकार की होगी। यदि किसी अध्यापक को अपने प्राचार्य से छुट्टी चाहिए किसी अपने कार्य हेतु, उसकी शैली अलग प्रकार से होगी। यदि आप किसी बैंक के मैनेजर को अपना क्रेडिट कार्ड या एटीएम कार्ड गुम हो जाता है, उसकी अगर आप शिकायत या उसकी रिक्वेस्ट या सूचित करना चाहते हैं, उसकी शैली अलग प्रकार की होगी। किसी विश्वविद्यालय में किसी कार्यशाला का आपको आयोजन करना है, उसकी शैली अलग प्रकार से होगी। महाविद्यालय में कोई सांस्कृतिक कार्यक्रम हो रहे हैं, संस्कृत विभाग के द्वारा आयोजित किए जा रहे हैं और आपको सभी महाविद्यालयों को, विश्वविद्यालयों को सूचित करना है एक पत्र के माध्यम से, तो उसकी शैली अलग प्रकार से होगी। सबकी शैली और भाषा में फ़र्क हो सकता है, तो इसलिए ये जो औपचारिक पत्र हैं, इनको जब हम लिखते हैं तो इनमें हमें विशेष ध्यान रखने की आवश्यकता होती है। यहाँ अगर गड़बड़ होती है तो हमारी बात कई बार संप्रेषित ठीक प्रकार से नहीं हो पाएगी। अनौपचारिक में गड़बड़ होगी तो हम उसको अगली बार सुधार सकते हैं। इसमें हमें बहुत सोच समझ के लिखना चाहिए। तीसरा जो उसका बिंदु है कि औपचारिक पत्रों में निजीपन की गुंजाइश नहीं होती। ये पर्सनल लेटर नहीं है। आप यदि किसी विश्वविद्यालय के कुलपति को पत्र लिख रहे हैं तो ये आपका पर्सनल लेटर नहीं हो सकता। आपको जो काम की आपकी बात है, जो आपको कहना है, उसको बिंदु बनाकर, और कई बार क्या होता है कि जितने बड़े पद के व्यक्ति होते हैं उनके पास उतना ही कम समय होता है आपके विस्तृत पत्र को पढ़ने का, इसलिए हमेशा विषय को ऊपर लिख दिया जाता है। जब आप उनका पद नाम और इत्यादि लिखने के बाद विषय ऊपर लिख देते हैं कि ये मेरा जो पत्र है वो किस उद्देश्य से लिखा जा रहा है, ताकि यदि उनको पास पूरा समय नहीं है पूरे पत्र को पढ़ने का, तो केवल वो विषय को देखकर समझ जाएं कि आप क्या निवेदन करना चाहते हैं। तो यहाँ पर बिल्कुल भी आपको आशा है कि आप ठीक होंगे, आपका समाचार मिला, सुखद समाचार मिला, परिवार में सब कैसे, ये इस तरह का कोई व्यक्तिगत बात आप औपचारिक पत्र में नहीं कर सकते। सीधा आप उनको प्रणाम महोदय संबोधित करते हुए, और आगे इसमें आएगा इसका उदाहरण कि कैसे आपको लिखना होता है। अपने मुख्य बिंदु पर, मुख्य विषय पर आप आ जाते हैं। चौथा बिंदु है सहज और विनम्र शब्दावली का प्रयोग होना चाहिए। इसमें आप उनको कोई व्यक्तिगत नाम से आप ना पुकार कर सहज और विनम्र, सविनय निवेदन है कि, सविनयम निवेद्यते, संस्कृत में यदि आप लिखेंगे सविनयम निवेद्यते, हिंदी में सविनय निवेदन है कि मम नाम आशीषः, अहम इंदिरा गांधी राष्ट्रीय मुक्त विश्वविद्यालयस्य मानविकी विद्यापीठे संस्कृत विभागे सहायक आचार्यस्य पदे कार्यरतो अस्मि। उसके बाद आपने अपनी बात को, अपना परिचय देते हुए बात को कहना प्रारंभ किया। तो इस सब शैली का आपको ध्यान रखना पड़ता है। उसका अगला जो बिंदु है कि औपचारिक पत्रों में संक्षिप्तता एवं स्पष्टता परम आवश्यक है। जितना छोटा होगा उतना ही स्पष्ट होगा। 3 पेज, 4 पेज, 2 पेज, इस सब की आवश्यकता नहीं है। जितना आप सटीक या कम शब्दों में अपनी बात को कह सकते हैं। कई बार ऐसा होता है कि बात वास्तव में इतनी बड़ी होती है कि उसके लिए आपको 1-2 पेज लिखने की आवश्यकता हो ही जाती है, लेकिन उसके बावजूद भी कोशिश कीजिए कि जितना कम हो, जितना संक्षिप्त हो, उतना आपके लिए, आपके कार्य हेतु सरलता आपको प्रदान होगी। और संस्कृत में क्योंकि हम लोग संधि और समास हमारे पास हैं, तो उनसे हम उनका लाभ उठाते हुए हम अपने पत्र को और भी छोटा कर सकते हैं। लेकिन ध्यान रखना है कि ऐसे समासों का और संधि का प्रयोग नहीं करना है जो आपके पत्र को क्लिष्ट बनाए। सरल हैं और सामान्य समास और संधि का आपने प्रयोग किया है तो ये चल सकता है। अगला बिंदु है कि औपचारिक पत्र कई प्रकार के हो सकते हैं, जैसे कि सरकारी पत्र, व्यावसायिक पत्र और आवेदन पत्र। जैसा कि मैंने आपको बताया कि किसी विश्वविद्यालय में आप आवेदन कर रहे हैं, संस्कृत विश्वविद्यालय है, संस्कृत महाविद्यालय है, तो उसके लिए आपको पत्र लिखने की आवश्यकता पड़ सकती है। व्यावसायिक पत्र, मान लीजिए क्योंकि कोई विभाग, जैसे दिल्ली विश्वविद्यालय में भी संस्कृत विभाग है और महाविद्यालयों में भी संस्कृत विभाग है, तो दिल्ली विश्वविद्यालय का संस्कृत विभाग यदि अपने महाविद्यालय के किसी संस्कृत विभाग या किसी आचार्य को पत्र लिखता है, तो ये किसी प्रोजेक्ट को लेकर या कोई कार्य दिया गया है उनको, हो सकता है कि उनको पेपर बनाने का कोई कार्य हो, मॉडरेशन का कोई कार्य हो, या कोई एक्सपर्ट कमेटी का कोई कार्य हो, तो उसके लिए जो पत्र लिखे जाते हैं वो सारे के सारे व्यावसायिक पत्रों में आते हैं। इसका एक उदाहरण भी हम लोग अभी देखेंगे। आवेदन पत्र भी कई प्रकार के होते हैं, जैसा कि नौकरी के लिए आवेदन करना, छुट्टी के लिए आवेदन करना, छात्रवृत्ति के लिए आवेदन करना, विशेष अनुमति या सुविधा के लिए आवेदन करना। कई बार क्या होता है, कई जो एम्प्लॉयज़ हैं वो छुट्टी के लिए आवेदन करते हैं, विद्यार्थी जो हैं वो अपने एडमिट कार्ड के लिए आवेदन करते हैं, या मान लीजिए किसी स्कॉलरशिप या फेलोशिप के लिए आवेदन करते हैं। तो ये सारे के सारे कैसे पत्र हुए? ये औपचारिक पत्र हुए। और संस्कृत विभाग में यदि आप हैं और संस्कृत के छात्र हैं, तो आप संस्कृत में भी विद्यार्थी बहुत सारे स्कॉलरशिप्स के लिए, छात्रवृत्ति के लिए या कोई विशेष सुविधा के लिए, मान लीजिए कि किसी बच्चे का एक ही समय में 2 परीक्षाओं की तिथि आ जाए, किसी और भी उसने नेट का एग्ज़ाम भी देना है और इधर पता चला कि विश्वविद्यालय का भी कोई परीक्षा होने जा रही है, तो दोनों में क्लैश हो रहा है, तो उसके लिए वो सूचित करना चाह रहा है कि आप कृपया इसकी डेट को आगे पीछे करें। या कोई किसी व्यक्ति किसी कोई विशेष रूप से कोई उसे स्पेशल कोई वो चाहिए, ट्रीटमेंट चाहिए, तो उसके लिए वो अनुमति मांग सकता है। तो उन सब परिस्थितियों में भी हमें औपचारिक पत्र लिखने की आवश्यकता पड़ सकती है। सभी आवेदन पत्रों की शुरुआत जो है वो बाईं ओर से की जाती है, आपके लेफ्ट हैंड साइड से। यहाँ आपने अनौपचारिक में आपने दाईं ओर से शुरुआत की थी, औपचारिक में आप अपने बाईं ओर से शुरुआत करते हैं। सर्वप्रथम क्या लिखते हैं? सेवायाम। सेवायाम लिखा जाता है। फिर अगली पंक्ति में उस अधिकारी का पदनाम तथा उससे अगली पंक्ति में पता लिखा जाता है। जैसे आप सबने अगर आप सामान्य रूप से लिखते ही होंगे, आपने देखा होगा, सेवायाम प्राचार्यः राजधानी महाविद्यालयः दिल्ली विश्वविद्यालयः राजा गार्डन नई दिल्ली 110015। फिर आपने लिखा विषय। विषय आपका जो भी है, आवेदन करना चाह रहे हैं परीक्षा हेतु या परीक्षा में प्रवेश पत्र प्राप्त करने हेतु आप आवेदन करना चाह रहे हैं, वो आपने मुख्य विषय लिख दिया। और इधर क्या शुरुआत किससे हुई, आरंभ किससे करेंगे? माननीय महोदया, इससे आप आरंभ कर सकते हैं। और जो पहली पंक्ति मैंने आपको बताया कि इसमें आपको बहुत ही विनम्र शैली का प्रयोग करना पड़ता है, तो सविनयम निवेद्यते। ये पूरा एक ढांचा हम इसका बनाते चले जाएंगे, बाद में इसका रूप भी देखेंगे, लेकिन अभी आप इसको मस्तिष्क में बनाइए कि इन दोनों में, उसमें हमने शुरुआत कहाँ से की थी, इसमें शुरुआत कैसे कर रहे हैं, इसकी शैली कैसी है, उसकी शैली कैसी है, इस प्रकार आप ध्यान दीजिए। अब ये एक नमूना आपके सामने व्यावसायिक पत्र का प्रस्तुत है। देखिए, अनौपचारिक का कैसा था और औपचारिक का कैसा है। वहाँ आपने दाईं ओर से शुरुआत की थी, यहाँ आप बाईं ओर से शुरुआत कर रहे हैं। जैसा कि मैंने आपको बताया कि संस्कृत विभाग, मान लीजिए किसी महाविद्यालय के प्राचार्य को लिख रहा है पत्र, तो कैसे लिख रहा है? संस्कृत विभागः दिल्ली विश्वविद्यालयः दिल्ली 11007, दूरभाष संख्या लिखी। और पत्र जो है व्यावसायिक पत्र, उनमें उनका लेटर नंबर भी होता है, डायरी नंबर जिसको बोलते हैं, वो उनका नोट होता है, वो उन्होंने लिख दिया दिल्ली विश्वविद्यालय संस्कृत विभाग जी, और तारीख डाल के ये डायरी में नोट होगा। फिर जिसको लिख रहे हैं उसको संबोधन कर रहे हैं, डॉक्टर आशीष कुमार प्राध्यापक इंदिरा गांधी राष्ट्रीय मुक्त विश्वविद्यालय दिल्ली 68। विषय लिख दिया, शोध परियोजनायां स्वीयोपलब्धीनां सार संक्षेपणम। महोदय नमस्कारः, चिरकालाद भवता पत्र व्यवहारो नैव साधिता। बहुत दिन हो गए आपने कोई पत्र व्यवहार नहीं किया है। आशा से विभागेन प्रदत्ता शोध परियोजना भवता परिपूर्णतां नीता स्यात्। आशा करते हैं कि विभाग की ओर से आपको जो प्रोजेक्ट दिया गया था वो आप उसमें परिपूर्णता से आप लगे हुए हैं। कृपया अस्याम योजनायाम स्वीयोपलब्धीनां सार संक्षेपणम अविलंबम प्रेषयतु। कि आपको जो प्रोजेक्ट दिया गया था इसमें क्या अभी तक आपने डेवलप किया है, क्या आपने अचीव किया है, क्या आपने कार्य किया है, इसकी सूचना कृपया शीघ्र विभाग को उपलब्ध कराएं। भवान सर्वथा जानाति यद अयम एकः कालबद्धः कार्यक्रमो वर्तते यस्य संपन्नता भवतः सहयोगम अवलंबते। कि आपको पता है कि ये बहुत ही इंपॉर्टेंट एक प्रोजेक्ट हमारे पास है, जिसमें आप जितनी तेज गति दिखाएंगे उतनी ही तेज गति से हमारा कार्य हो पाएगा, इसलिए आपके ऊपर निर्भर कर रहा है। कृपया आप इसको शीघ्र विभाग को वापस से प्रेषित करें। एक प्रोजेक्ट किसी को दिया गया था, उसके बारे में डिपार्टमेंट उससे कुछ पूछ रहा है, तो ये व्यावसायिक पत्र हो गया। और लास्ट में अतीवातुरतया शोध परियोजनायां भवद उपलब्धीनां सार संक्षेपम प्रतीक्षे सप्रेम भवदीयः प्रोफेसर ओमनाथ बिमली अध्यक्षा। जो डिपार्टमेंट का हेड है उसने उनका नाम अंत में दाईं ओर नीचे की ओर आ गया। तो ये शैलीगत आपने देखा कि अनौपचारिक की शैली कैसी थी और औपचारिक की शैली कैसी है। भाषा यद्यपि एक पत्र के माध्यम से आप देख चुके हैं, फिर भी भाषा की दृष्टि से कुछ बिंदुओं पर हम थोड़ा सा चर्चा और कर लेते हैं 2 मिनट के अंदर। देखिए इसकी भाषा कैसी है अनौपचारिक की, कि अनौपचारिक पत्रों में परिवार के सदस्यों या मित्रों की बातचीत जैसा निजीपन होता है। और संस्कृत के अनौपचारिक या व्यक्तिगत पत्र प्रायः एक विद्वान के द्वारा दूसरे विद्वान मित्र को लिखे जाते हैं। तो ये हमारी अनौपचारिक पत्र की भाषा हो गई। और जो हमारी औपचारिक पत्र हैं उनमें क्या विशेषता है कि औपचारिक पत्रों की भाषा सरल किंतु विशिष्ट और निश्चित होती है और स्वाभाविक विनम्रता का ध्यान रखा जाता है इन सब चीज़ों में। व्यक्तिगत पत्रों की तरह विनम्रता की अलंकारिक पराकाष्ठा इसमें नहीं होती। उसमें आप अलंकार की शैलियों का प्रयोग कर सकते हैं, लेकिन इसमें आप अलंकार नहीं लगा सकते क्योंकि आप अपनी बात को आगे संप्रेषित नहीं कर पाएंगे। तो इन्हीं शब्दों के साथ आज के हमें वक्तव्य को ही विराम देना पड़ेगा। आशा है कि आप इससे पत्र अनौपचारिक और औपचारिक पत्रों में क्या भेद है इसको समझ पाए होंगे और आगे जब आप पत्र लिखेंगे तो इन सब बातों का आप ध्यान रखेंगे। आप सभी को मेरा सादर प्रणाम। सर्वेभ्यो नमो नमः।